What is it? She's running.
How progressively? How quickly?
Stupid.
What you just heard was an auditory simulation of schizophrenia. People with schizophrenia have to deal with voices like these every day. But as you'll soon find out, schizophrenia is much more complex and involves more than just hearing voices.
Schizophrenia is a chronic and severe disorder that affects how a person might think, feel, and act in life. Schizophrenia is not common compared to other mental disorders, but approximately 8 out of 1,000 individuals will have schizophrenia. Also, this disorder lacks in numbers. It can be very disabling compared to other disorders. People with this disorder can experience many things. They may hear voices or see things that aren't there. They even may believe other people are reading their minds, controlling their thoughts, or plotting to go against them. You can only imagine how scary it may be to have these thoughts. Also, what is very interesting about this disorder is that it tends to develop in teens ages 16 to 30. Males tend to get schizophrenia earlier than females too. This is only the tip of the iceberg when talking about schizophrenia.
When talking about the symptoms of schizophrenia, they seem to fall under 3 broad categories: positive, negative, and cognitive symptoms. Positive symptoms are the psychotic behaviors that are not seen in healthy minds. This involves losing touch with the fabric of reality. For some patients, it may come and go, but sadly for others, they may experience it consistently throughout their life. Some of the symptoms may include hallucinations and delusions. Hallucinations are sensory experiences that occur in the absence of a stimulus. They can happen in any of the 5 senses, but voices are the most common. These can be internal or external voices. Internal meaning that they come from one's own thoughts, and external meaning they seem to come from another person in a room. The voices can talk to each other or even talk to the patient. Delusions are essentially false beliefs a person may have. These delusions even persist without any evidence of truth within the theory they have. For example, schizophrenics can have delusions that seem bizarre, such as believing that neighbors can control their behavior with magnetic waves. Something as wild as that can be a truth to a schizophrenic. This is also often compared to paranoia due to their untrusting nature. They can also have a thought disorder, which are dysfunctional ways of thinking and or even movement. And they can be described as agitated body movements. For example, a movement disorder could lead to a person becoming catatonic, which we'll go over later in the video. And also, as a fun little side note, all these previous images you saw, kind of like drawings, were drawn by a person who has schizophrenia, and this is essentially what she sees in her daily life. Moving on, we have the negative symptoms. These symptoms can be described in many ways. For example, we have the flat effect, which is reduced facial expressions or reduced feelings of pleasure in everyday life. Also, it could be described as difficulty beginning and sustaining activities, and even some people might reduce speaking entirely. This can definitely affect people's everyday tasks and even personal hygiene. Finally, we have cognitive symptoms. The severity in this category varies from patient to patient. These also may be very difficult to detect. Usually specific tests have to be given to even root out these problems as part of the disorder. So some of the cognitive symptoms may be poor executive functioning, so it's like the ability to understand information and make decisions from it, or trouble focusing on certain tasks or paying attention, for example, like in class, and then problems with working memory, so the ability to use information immediately after learning it. With all these symptoms, people describe it that it is hard to maintain jobs and social relations. One graphic account of schizophrenia is from a patient named Jayamala. His details of the disorder is truly haunting. Jayamala used to be a nice person and an excellent student, but when he first started hearing the voices, it changed his life and demeanor completely. He started ill-treating his mother and brother verbally and even physically. On top of that, he started losing his intelligence, receiving grades that would not let him pass classes. As you can see, it devastated his career. This is just one of the many stories of how lives are ruined by schizophrenia.
Schizoaffective disorder. A person with schizoaffective disorder experiences a combination of schizophrenia symptoms, such as hallucinations and delusions, and mood disorder symptoms. In the past, the person had to have had both sets of symptoms at the same time to receive a diagnosis of schizoaffective disorder. The DSM-V update in 2013 now says that to be diagnosed with schizoaffective disorder, a person must have experienced mood disorders for most of the time they have also had the psychotic symptoms of schizophrenia, from when they first started having symptoms up to the present. A case study of this is schizoaffective disorder includes a combination of both schizophrenia and affective disorder symptoms. Diagnosis of a schizoaffective disorder is based on a careful evaluation of the client's history, as well as current symptoms. Misdiagnosis may occur if only current symptoms are considered. Treatment of schizoaffective disorder includes neuroleptics, emetics, and antidepressants. The client must be carefully assessed for side effects. The elderly client poses special challenges. Case management by a clinical nurse, specialist, or psychiatric nurse practitioner with the ultimate goal of increased quality of life for the client includes assessment of client for positive and negative effects of medication, client, family, and caregiver education regarding medications, identification of significant symptoms, and assistance with coping skills and support. A second form of schizophrenia is catatonia. Catatonia includes extremes of behaviors. Catatonia can include excessive and peculiar motor behaviors, sometimes referred to as catatonic excitement. Catatonia can also include decreased motor activity and engagement. For example, people in the catatonia stupor demonstrate a dramatic reduction in activity where the patient cannot speak, move, or respond. Virtually all movement stops. Catatonia can occur with schizophrenia and a range of other conditions, including bipolar disorder. For this reason, it is now considered a specificer of schizophrenia and other mood disorders, rather than a type of schizophrenia. And a case study of this is, for example, patient A is a 20-year-old male of Mediterranean origin diagnosed with a paranoid schizophrenia at the age of 23. He was hospitalized several times due to the psychotic episodes characterized by religious delusions and auditory and visual hallucinations. He is living in an assisted living facility where the medication is offered to the residents, but where they have to take it by themselves. He uses cannabis daily and does not use any other substances. Drug history mentions the use of risperidone and fluoxetine deconate, the latter since 2008 up to the present. At the end of 2008, he developed a progressive condition in which he showed less mimicry, staring, negativism, mutism, and immobility. There were no signs of autonomic dysregulation such as increased body temperature or unstable blood pressure. A third form of schizophrenia is childhood-onset schizophrenia. The symptoms of schizophrenia normally appear during early adulthood, but they can sometimes emerge during childhood at the age of 10 years or earlier. It is extremely rare, with an incidence of less than 0.04%. If schizophrenia occurs in a child, it is very serious, and treatment is needed. However, healthy children can experience hallucinations, so if this happens, it does not mean that a child has schizophrenia. A fourth form of schizophrenia is disorganized schizophrenia or hebephrenia. Disorganized thinking and behavior are features of schizophrenia. The person may have incoherent and illogical thoughts and speech. This can make it difficult to perform daily activities such as preparing meals and taking care of personal hygiene or washing. People may not be able to understand what the patient is saying. This can lead to frustration and agitation. While disorganization is a feature of schizophrenia, it is no longer considered a separate subtype. The last form of schizophrenia is paranoid schizophrenia. A person with schizophrenia may have false beliefs or delusions that an individual or group or people are trying to conspire to harm them or their family. They may spend time thinking about ways to protect themselves from the people they believe who are persecuting them. While delusions can still be key to a diagnosis of schizophrenia, this is no longer considered to be a separate subtype of the disorder.
Due to the unknown cause of schizophrenia, treatments tend to focus on finding and eliminating or mitigating symptoms. These treatments include antipsychotic medications and different types of psychosocial treatments. But when these treatments are combined, psychologists say that these show promising results for recovery. Antipsychotic medications are usually taken as a pill or in liquid form. These medications help mitigate symptoms, but they come with many side effects like drowsiness, dizziness, weight gain, tremors, and many more other symptoms. Psychosocial treatments, on the other hand, are more mind-based. These treatments are made for patients who have already stabilized with their schizophrenia. This treatment focuses on helping individuals deal with everyday challenges with their illness, while also learning to cope with their illness in an effort to live a normal life. Another good way for treatment is through family and friends. Having support like this to rely on can make the path to recovery for a schizophrenic patient way more easier. In conclusion, schizophrenia is obviously a life-ruining disease. Millions of lives are affected each year, but instead of looking on the bad side of it, it is better to look into the future. The outlook for schizophrenia improves each year. Many people experience an almost full recovery, which is a major improvement. So it seems there is a light at the end of the tunnel for those affected by this terrible disease.